Are you experiencing numbness and tingling going down your leg? Here is a 3-step process that you need to do in order to get relief. I'm Dr. Clayton, and when my patients come in and complain about numbness and tingling, it's typically coming from one of two areas. Least common, your piriformis muscle. It's a muscle deep in your pelvis that can compress your sciatic nerve, creating numbness and tingling. If you feel like that muscle is creating your pain, check out this video. It's how to relieve piriformis syndrome. It has some great exercises in there. But in this video, we're going to be going over how the numbness and tingling can be coming from your lower back, whether it's a tight muscle, a disc herniation, or just inflammation creating that numbness and tingling. This 3-step process I'm about to give you is going to give you tremendous relief. The first step is going to be taking pressure off of the nerve. There's 2 ways you can do it. This first way is going to be great if you're in acute pain or the numbness and tingling is really severe. You're going to want to start here. You're going to lay on your side. The affected side is going to be up towards the ceiling. You're going to take this top leg and put it behind the bottom leg. That's going to traction your hip this way, opening up the space where the nerves come out of your spine, taking the pressure off the nerve, giving you relief. Hang out here for 5 minutes. If you're a little less acute, maybe you only get the numbness and tingling in certain positions, like when you're sitting, this is a great exercise for you. You're going to lay on your stomach, elbows underneath your chest, and you're going to just pump back and forth. Do about 10-15 of these. This is going to flush that inflammation out of your lower back, taking pressure off that nerve, and giving you relief. Second step, activate that core. One of the main functions of your core is to prevent motion from happening in your lower back. The more motion that happens in your lower back, the more irritation that nerve is going to get and the more numbness and tingling you're going to feel. You could do something as simple as a modified plank on your knees, on your forearms, tuck that pelvis so you don't feel pressure in your lower back and hold for 30 seconds. If this is too easy, you can open up your knees a little bit more and reach out in front of you, making sure you're not shifting through your lower back. This is a great core exercise. If that's still too easy, you can make the lever a little bit longer and do a plank, lifting one leg, and again, making sure that you're not shifting or twisting through your lower back, holding for 2-3 seconds and do about 10 of those. Those are both great options for some core exercises that protect your lower back, decreasing the inflammation there, giving you relief. Before I show you that third and final step, don't forget to hit that subscribe button. It'd be greatly appreciated. The third and final step is making sure you're doing exercises that teach you how to use your hips. More than likely, you're having the numbness and tingling because you've overused your back. For example, if you go to pick something up off the ground and you're using your back and not your hips, you're going to irritate that nerve, creating the numbness and tingling. So you can do things as simple as like a glute bridge. When you're laying on your back, knees are bent, drive your heels through the ground and lift your hips. Make sure that you feel it in your glutes and hamstrings. Go back and forth 10-15 times. If that's too easy, this is one of my favorite progressions to the glute bridge. You're going to lift your hips. From here, drive your elbows. You should feel your core engage and then lift one leg. And then you're going to do the opposite leg, making sure that your hips aren't starting to sag. Keep your hips up off of the ground and lift. From there, if you want to challenge yourself, you can cross your arms and do the same thing. This is a lot harder. Just make sure that you're not letting your body shift and twist when you're doing it. Keep those glutes engaged, squeeze that core, and lift one leg at a time. That's a great way to challenge your core and your glutes all in one. Give it a try. That is the 3-step process I take my patients through that are experiencing numbness and tingling. If you're experiencing something else and want some input, drop a comment down below. I'd love to help you. Until next time, keep moving and enjoy the rest of your day.